All right. So I hope you get the notification that this meeting has been recorded. So a very quick overview. My name is Carissa, and we do have Karen here as well as our course coordinator. So before we start, we would like to acknowledge the traditional owners of our land where we work and live here in Australia, and also would like to acknowledge their elders past, present, and emerging. And welcome to the demo class for the medication calculation with Nursing Education and Training Australia. A quick background about myself. My name is Carissa, and I am one of the nurse educators in NETA. Background wise, I am overseas trained, so I myself have been through your um, path. However, I did the bridging course, not the NCLEX and the OSCE. I have done NCLEX in the past and also have been an OSCE educator since I became an educator in Australia. So I used to work at St. George Private Hospital, which is in Kogarah, and also I used to work as a nurse educator in Campbelltown and covering the Southwestern Sydney Local Health District. So that covers Bankstown, Fairfield, and I think Vishwa helped me with this one yesterday. Maybe you want to help me, Vishwa?
Yeah, sure.
So Fairfield, Bankstown, Liverpool, Campbelltown, and Bowral. Did I
Wow,
miss?
that's right.
Did I miss something?
And now,
Um, Yes, I used to be the new graduate educator in that district. And then I moved here in Wagga Wagga, which is a beautiful regional area. And I did the new graduate educator role as well across 37 hospitals. So, looking into my background, I think I am credentialed to actually teach overseas nurses who will become new graduate nurses in the future. So I did teach for the bridging course as well in the past in Sydney. So yeah, that's all about me. And we do have Karen here as well. And I know that I just did give Karen a notice in the last minute. And thank you so much for dialing in. But do you want to introduce yourself, Karen?
Hi, everyone. Wonderful morning to whatever part of Australia you are, or if it is evening in your place, wonderful evening and welcome to Nursing Education and Training Australia information session. I am the course coordinator of NETA. I have been an internationally qualified RN as well. I was trained in the Philippines. I worked there for 2 years after I graduated. I was once a nurse educator and I have been assigned to many areas of the hospital as well in different areas. And then I've moved to the United Arab Emirates. I worked there as an RN for 7 years. So I don't want you to calculate my age because you'll know how old I am. And so I've worked there as an RN, and then I've moved to Australia. I was once a director of nursing in one of the day surgery here in Victoria, in Melbourne to be specific. And now I'm a full-time nurse educator and also a full-time course coordinator of NETA. So credential-wise as well, for sure, Carissa will not put me on board if I am not capable of teaching you guys. So I'm also proud to be part of this team. Rest assured, you're in good hands. All our educators are Australian RNs and also um, educators and leaders in their respective fields.
thank you.
Thanks very much, Karen. So yeah, let's move on. So today is a medication calculation, and this is how we will be teaching in NETA. Medication calculation is a very broad, again, is a very broad topic. So we will try to cover as much as we can within the next hour. But when you enroll with us in NETA, you will have a lot of resources on top of the classes that we will also be giving away. So just a very quick NETA fast facts because we want you to know who we are and who you're joining with. We want to provide you very truthful information because we ourselves as registered nurses overseas before, we also had that feeling of we were like kind of lost. We didn't know the whole process. And that's the reason why we're here, because I think 99.9% of our educators have been through your journey as well. So we're the leading provider of outcome-based assessment preparation course in Australia. And why we said that we're the leading provider is because we are the institute that actually has the most number of passers. So we are very student-centered. Very people focused, and we are very outcome oriented. We want to see results, and this is the reason why we are very passionate about being able to be with you in your journey, because we really want results, and that is your success. So as much as we want you to pass, we also want you to be in the Australian registered, in the APRA register. So we have 42 NCLEX passers, and we have 11 OSCE passers. And these 11 OSCE passers have completed the whole outcome-based assessment program, and they're already registered nurses as well. So we want you to be one of them. So you can see the we can't fit everything in one whole slide, but we really want you to be like them, who has passed and who has who did succeed in both NCLEX and OSCE. What does this mean? If they are able to do it, and if we were able to do it, it is very possible that you will be able to do it. And it takes a lot of hard work, dedication, commitment, and of course, a lot of support as well. And that's the reason why we are here in NETA. Ta-da! These are our registered nurses. This is how you're going to appear in the APRA register. So some have photos, some have not. I just searched them in the APRA register to those who don't have the photos. So what you actually, when you become a registered nurse, you go to the APRA register. So you go apra.gov.au, and then you can type the name of the registered nurse, whether that's yourself when you're registered, whether that's me. You can find out about me. You can find out about Karen. All of our registered nurses, all of our educators are registered in Australia, so you can find out about us as well. When you click on that view details also, it also says there, when are they registered? So you can actually see how long have we been registered in Australia and how long have we had an Australian nursing experience. So everything is very transparent in APRA, and that's what we want you to know as well, because you need to have that very good education prior to choosing an education provider. So see first whether or not the education providers are capable of teaching you, and see the number of experience as well that they have. And look at this. These are our Australian registered nurses that came through NETA. And we really, really want you to be in the APRA register. We want to search you. So early this morning, I did search few of our registered nurses, and because I couldn't fit them here, but there are 11 of them. This is how we conduct our OSCE. As I said, we are very person-centered, we are very people-focused, and we really want your experience to be positive when you go to OSCE. We don't want you to go out of the OSCE and feel like you did not learn, or you didn't, you feel that your money's worth was not as what you have expected. So all of our students in OSCE, we make sure that they're just not happy, but they're actually confident to be able to go to their test and to be able to make sure that they're full armored, as what our students said. So everything that we have provided in our NCLEX and OSCE, whatever is in your learners portal and whatever we have provided, is actually very sufficient for you to be able to pass your test. Just fast facts. Our vision is that we become the preferred provider for the outcome-based assessment for the internationally qualified nurses. And what does that mean is, how are we going to do that? Is that we provide truthful information, we make you ready, and we are very we're very result focused. So we want your results, and that is why we want to be the preferred provider. Our mission is 100% passing percentage of the OBA test. As I attended one seminar, and there was the CEO of the NMBA, they were not allowed to say the passing percentage as of yet. And I do understand that, because in NETA, we as well is aiming for 100% passing percentage. OBA being very new to the system, I think the passing percentage isn't a measure at the moment. If you see the NCSBN, their passing rate is 93%. And if you see other providers of the NCLEX in the United States, they're also continuing to develop, and they're on the 80s and 90%. So in NETA, we have counted our number of passers, and that was what was presented to you earlier. So the NCLEX and OSCE is a blended learning. It is a combination of self-paced. So therefore, you take hold and you take control of your own studies. You are accountable for your own studies because you are the one who is going to take the test. And that is the reason why we put it there as self-paced. It is also a combination with online study. So there are a lot of materials that you can see online. There are a lot of recordings of your NCLEX and OSCE teachers, and we do live teleconferences like this. And this is how we conduct our classes. Today, I am talking more because it's a demo class, but in real classes, we actually make it as interactive as possible. We let our students think, because critical thinking is very important. And then we do have face-to-face sessions for our OSCE. All of the resources and everything that is included in the package is accessible for 6 months. And you have your student support. Faith, who is holding that yellow book, is your student support person. She is also a nurse educator, and she teaches OSCE in Sydney. And we do have library services, and that's where you see us with our books. There, and Karen as well, if you can see Karen's background, she's got a lot of books there. So all of these books are available for you to borrow. All of the things, though, that we've put in your program is already a combination of all of these books. So if you still want a physical copy, that is fine. If you're a tactile learner where you want to touch something, you can still use these books. However, all of the learning materials, resources, classes, face-to-face, everything is already integrated there, that you don't need a book. So for today's session, we are talking about medication calculation, and this would actually cover for both NCLEX and OSCE. Okay, so I'm not sure, is anyone familiar with this image? Yep, I can see Vishwa nodding her head. Yep, anyone else is familiar with this image? Yep, Rija is nodding her head. Sushma as well? Yeah. All right. So this image actually is a distribution of the content of questions in your NCLEX. So this is part of the NCLEX test plan. And what we will be doing today is a 15% of your test in NCLEX, which is pharmacological and parenteral therapies that include medication calculation. So that's 15% of the total questions. In OSCE as well, so you can see that there is calculating drug doses, subcutaneous and intramuscular injection, and medication administration. And this is where medication calculation would come in as well. So we're actually targeting both NCLEX and OSCE with this session today. So again, I would say Rija, Vishwa, Sushma for NCLEX, is that correct? So as Bhavya, and I can see nods. I'm not sure. We do have Marikar, I think, is also NCLEX. Is that correct, Marikar?
Yes.
Yes. Colleen. Oh, actually, you know what? My friends call me Colleen back home. Sushma for OSCE. Colleen, what are you looking for? Is it I think Oski.
NCLEX and OSCE.
Oh, NCLEX and Oski. Perfect. Colleen, where are you dialing from?
Sorry?
Where are you dialing in? Are you in Australia or overseas?
Australia.
You're in Australia. And which part?
Yeah. Near Sydney?
In Sydney. Perfect. You're on lockdown at the moment.
Yeah.
It's a good way that you are with us today.
Mhm.
Whereabouts in Sydney are you, Colleen?
West Ride.
West Ryde. Perfect. It's a beautiful place there. I feel weird when I'm using my own name, Colleen, calling Colleen. All right. So so for NCLEX and OSCE, this is where your medication calculation would come in. All right. And Sumana, if you can type because I know I've spoken to you a number of times. I'm not sure if you're aware that your microphone is on mute, but if you can type what you're looking for, NCLEX or OSCE, that would be awesome. All right. Oh, Sumana, yes, you are there. Thank you.
Yeah.
Are you looking for NCLEX or OSCE or both?
NCLEX.
NCLEX, perfect. So this is 15% of your NCLEX, and this demo class will actually give you an overview of what is expected of you.
Okay.
Good. All right, so let's go to the nuts and bolts of medication calculation. This is what you would need when it comes to medication calculation. And when you say nuts and bolts, if you would understand that phrase, this would be the structure. These are the essential components that you need to know. So the first thing is calculation according to required dose. So this is, I've put here H over W times the volume. I know that some people would say stock required over stock strength. So that's your sunrise over sunset times the volume. And that is also good. The reason why I put here is because it's very easy to understand. And what I really want, and if you believe in what I believe, what I really want is to make things simple. H over W is husband over wife. Sorry, wife over husband. This is wrong, by the way. This is wife over husband, which means that W is a wanted dose and husband is the stock on hand. So let's just quickly do that. So this is W over husband. So that's wife over husband. And if you are dealing with liquid, of course, you multiply that with a volume. So in that case, your wanted dose, whatever you want, whatever the doctor wants, whatever is ordered, should be on top. Okay, and that is wife over husband. Don't think of anything else. It is in decision making. Wife always is on top of the husband when it comes to decision making. So that means whatever the doctor wants, whatever the order wants, it should be on top. You divide that with your stock on hand. If you're dealing with a volume, then you will be multiplying that with a volume. Now let's look into this as an example. If you look into the last part, though, it says here that conversion is very important. So you have to make sure that your units of measurements will match each other. So you need to make sure that you also convert prior to the computation. So let's look into this. The medication order is for Dilantin 50 milligrams, and the pharmacy delivered 125 milligrams in 5 meals. What dose would you administer? So what is our formula again? You're all on mute, but I can, you're all on mute, but I can actually lip read. Okay, so what's our formula again? We have wife over
husband
Over husband times volume.
times the volume. All right. The first thing that we need to check, though, is are they all units of measurements compatible, or are they what we need? So we need That's milligram and that's milligram. Do we have to convert? No, we don't have to convert. And that is mil. And it asks for what dose would you administer in mil. So all of, we're looking for mils in the volume. Okay, so there's no need to convert these units. So what is our wife? What is our wanted dose?
2 ml.
50 milligrams, yeah.
Milligram.
And what is our husband? Stock
One.
on hand,
125
125
125.
milligram.
So I'm just moving around. Okay, 125 milligrams. And what is our volume?
5 ml.
5
mils.
ml.
5 ml. Perfect. In that case, we are looking into ml as the last answer. Is that correct?
Yeah.
Yes. Therefore, if you remember your algebra and good grief, yay, algebra, it actually made sense now that we studied algebra. I thought we don't use that in our life, but yes, we do use it. You actually cancel whatever is on top, you cancel whatever is down. So milligrams and milligrams is now canceled. Now you have to evaluate yourself. You're left with mil. Are you on the right track?
Yep.
Yes, you are on the right track. So I will leave that calculation up to you. 50 divided by 125 times 5. What's your
2
answer?
mils.
2 mils.
3, did you say?
2.
2.5.
2 mils.
Somebody says 2.5. Now I need to bring out my calculator then so that we will be on the same page. Oops.
It's 2 ml.
It's 2.5. I just want to make sure because this is a demo class, and you know what will happen. They might say, "Oh, Carissa did a demo class and she did it wrong." So 50 divided by
125
125 is 0.4 times 5
is
is
5. 2.
2.
2.
50 divided by 125, because I saw Vishwa's eyebrows did like this. So 50 divided by 125 is 0.4, and you multiply it by 5 mils is 2. Is that correct?
Yes.
Okay, so we have an answer of 2. Perfect. Let's go to the next one. The next one, so we've done our calculation according to required dose. Let's look into the calculation according to weight. So this one is, people find it complex, but I actually find it very easy because it only takes analysis. So normally what they will give you in NCLEX is a dose per weight per day. Normally as well, or if not per day, per dose, it could be per dose, per day, per minute, per hour, per week. Okay, so it could be but it's actually the time that you are going to administer the dose. And normally they give you the weight because it is a calculation according to weight. So let's analyze a problem. The physician ordered dopamine, 8 micrograms. So that's the dose, per kilogram. That's the weight, per minute. Okay, so that is what is wanted. This is what the doctor wants for a patient that weighs 220 pounds. Calculate the dose per minute the patient will receive. So we need micrograms per minute. Is that correct? Yes or no?
Yes.
Yeah.
Yes, perfect. Now, first things first, are all of our units of measurements actually singing to each other? That means, are they coinciding to each other?
No.
No. There is a kilogram here and there is pounds here. Yes? So what we need to do is actually to convert pounds to kilograms because the doctor wants 8 micrograms per kilogram per minute. So then we need to convert 220 pounds to kilograms. What is the conversion there?
Divided by
One-
2.2.
2.2.
220
So-
pounds divided by
2.2.
2.2
2.2 for the kilogram, isn't it?
kilogram. Yeah.
Okay. So in that case, what is the answer?
100. 100 kilogram.
100 kilograms. So your patient is actually 100 kilograms. So the doctor says, please give 8 micrograms in every kilogram of that patient in 1 minute. So what do we do now? 100 kilograms
Multiply by 8.
times 8
8.
micrograms. Is that correct?
Yep.
What is your answer?
800
8.
micrograms per minute.
800. So therefore, that's per minute. So therefore, it is 800
cc per minute.
micrograms in every minute. So that patient will be receiving 800 micrograms for 1 minute. Is that clear?
Yeah.
So that's the concept. And if you apply this concept in any medication calculation that would, would ask according to weight, then there is no way that you'll be able to miss that. All right. So now we're done with required dose. We're done with the weight. Now let's go to meal per hour. Isn't that easy, guys? Do you find it easy? Yeah, it's very easy, isn't it? Yeah. That's the reason why I love math, because it doesn't need memorization. It just needs analysis. You don't really have to bring all of those numbers and formula in your brain and go to NCLEX and OSCE. Just have to analyze it. And that's the reason why it's really good when you go there and your head is very light, very fresh. Okay, let's go to meal per hour. So very obvious. The formula is volume over time. And because we're looking into meal per hour, our volume should be in meal and our time should be in hour. So let's have a look at this one. A nurse is to administer a packed red blood cells of 330 ml over 3 hours. How much in ml per hour will the nurse set the infusion pump to? What's your answer?
110
ml per hour.
How did we go? How did we do that?
divide volume over time.
Volume is 330 ml. We don't have to convert that. Okay, unless this is in liter, then you have to convert that. Okay, but it's already given to you in ml. Now we are giving it in 3 hours, so that's divided by 3.
3.
Yeah, and what's your answer?
110.
10 mil per hour. So in the real NCLEX, what will happen is the units of measurement will be given to you. Okay, there is no way in NCLEX that you have to write meal per hour. It will be given to you. In OSCE though, it won't be given to you. So you have to compute it, and you need to make sure that you're actually on the right path. So if it's asking for meal per hour, check yourself. Am I doing a hour? Yes, you are. Therefore, you're on the right path. Okay, you're on the right track. So we're done with calculation according to required dose. We're done to calculation according to weight, meal per hour. Now let's go to drops per minute. Isn't it easy? Now we'll make this more easy. In drops per minute, we have a very generic formula. Joanna, who is our senior NCLEX teacher, she said she calls this vaginal fart because it's V for vagina, fart for FRT. So I don't know if you want to call that. We're all nurses here and all health practitioners, and it's normal to say that. So for you to remember, if that's easy to remember, let's say it's vaginal fart. Okay, so V is for volume, D is for your drop factor, FR is your flow rate, T is your time. Now for your volume, it has to be in mils. For your drop factor, it's always drops per mil. For your flow rate, it has to be drops per minute. And for your time, it has to be all the time in minutes. Okay, this is drops per minute. Okay, so let's go and check. So a nurse is to administer 1 liter of 0.9 normal saline to a client with dehydration. The nurse will run this over 5 hours. Calculate the drops per minute if the drop factor is 20 drops per mil. So let's calculate that. So it says here VDF equals FRT. So let's delete, let's erase all of these so that we will have much space. So we have VDF equals FRT. So let's have a look. We are looking into the flow rate, isn't it? Drops per minute, that's what we're looking for. So how do we get the formula then? Again, it's algebra. So we want this to remain in that side of the equation because that's what we're looking for. In algebra, my algebra teacher used to tell me, whatever you do on top, you can cancel it if you put that at the bottom. Is that correct? Yes.
Yeah.
And she
Yeah.
further said, whatever you do to the right or to the left, to make the equation equal, you have to do in the other side as well. So if I've put divided time from the right, I have to divide it as well on the left. And that is our formula. Our flow rate is equal to the volume times drop factor times time. So what's our volume? Our volume is 1 liter,
1
but we
liter.
said that it has to be in mil, isn't it?
Yep.
So
Okay.
you have to convert that 1 times 1,000. So that becomes 1,000 mil. Good. What about your drop factor? What's your drop factor?
20 mil.
20 drops per
20 drops
per
per mil. 20. Can I just use GTTS?
Yeah,
Per mil. Good. And what about your time?
5 hours.
5 hours. But didn't we say that it has to be in minutes?
Yeah.
60 minutes.
60.
Okay. So let's compute that then. How much is it? I'm also computing. I always tell students to compute it over your laptop or your
3,000.
computer. So 1,000 times 20
20
divided by
divided
5
5
times
into
60.
60.
So what's your answer?
66.667.
Okay, let's put our answer on top. 66.67 drops per minute. Okay. Is that your answer then? Is that your answer? Yes or no?
No.
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 Okay.
Can
Why
you
not?
repeat?
67 drops per
1,000
minute.
times
67 drops per minute is your answer. Is that correct? Okay.
Drops per
Somebody said, can we repeat? Which one do you want us to repeat? Was that Colleen who said?
Yeah.
Yeah. So which one do you want us to repeat? So our, we have said here previously that it is our volume times the drop factor, this is F by the way, equals to FRT, which is your flow rate times time. That is understandable. That is our formula, right? For us to be able to get the flow rate, our formula becomes VDF over T, because algebra tells us for us to cancel T, we need to divide it, and then what you do to the right, you also do to the left. So VDF over T. And that's what you need to memorize if you want to memorize. But if you don't want to memorize, definitely just analyze vaginal fart. That is your formula. Now, 1,000 is your volume, 20 drops per mil is your drop factor, and 5 hours is your time. But we need that time to be in minutes, so we multiply that by 60. So if you multiply 1,000 by 20, it's 20,000 divided by 5 times 60 is 300. You will get an answer of 66.67 drops per minute.
Yeah.
Is that correct?
I get it now. Yeah.
Yes. Beautiful. Now, is that your final answer? Will you give that to NCLEX? We need to give NCLEX something that is deliverable, something that you actually can give. Can you give 66.67 drops per minute?
No.
We can give 66 drops, but a 0.67, can you give a 0.67? Just imagine yourself going into that roller and getting the 0.67 of a drop. How can you do that? It is very impossible. Therefore, you have to round that off to something that is deliverable. Okay, whole number for drops per minute is deliverable. So it becomes 67
7.
drops per minute, and that is your answer. Perfect. Easy?
Yes.
Very easy. Good. Now, so we are done with your drops per minute. So we're actually done, done, and that's the nuts and bolts of medication calculation. That's all you have to know. Now, the common medications,